Again, welcome everyone to the webinar titled Empowering Voices, Exploring the Roles and Types of Patient Advocacy in Healthcare. The webinar is jointly organized by the Duke-NUS Center of Regulatory Excellence, or CORE, and the SingHealth Duke-NUS Global Health Institute, or SDGHI. My name is Yong Kian, and I'll be your host and moderator for today. Briefly about the webinar, we will discuss the role of a patient advocate, what are the different types of patient advocates, and the skills needed as one. We will also discuss the importance of partnerships between advocates and other stakeholders, such as healthcare providers, policymakers, and even the industry. Then we will hear from a local patient organization and their journey in patient advocacy, the challenges and progress they made so far. So I'm really very pleased to welcome two wonderful speakers to join us today who have done some amazing work in patient advocacy and patient engagement, both internationally and also here in Singapore. First, I would like to introduce Ms. Crystal Barter, CEO of Humanized Health, a patient-led advocacy agency based in Australia, working with multiple stakeholders to empower patients and improve health outcomes. Crystal has over 20 years of experience as a non-profit leader, advocate, and social entrepreneur. She was one of the first women in Australia to undergo a preventative mastectomy after discovering she had the BRCA1 gene. This inspired thousands, including Angelina Jolie, in a global movement and conversation on genetic risk and preventative health. I met Crystal a couple of months ago to chat all things about patient engagement, and she is as inspiring as a profile. So welcome, Crystal, and thank you for joining us today. Next, I would like to introduce our second speaker, Mr. Phua Wee Sing, who is the Chief Rare Advocate at the Rare Disorders Society Singapore, or RDSS. I've known Wee Sing since early this year when we met through some of the work on patient engagement we've been doing. He is a full-time caregiver of his son, who has been diagnosed with X-linked adrenoleukodystrophy, or XALD, since 2014. He's currently serving in various non-profit organizations, such as the Kong Hwa Very Supportive Parents, which is the parent support group in the Kong Hwa School. He's also a PhD mentor for the Ministry of Education here in Singapore, and the Vice President of the Bowling Association for Disabled. Wee Sing is also the founder or co-founder of the XALD Patient Advocacy Group here in Singapore in 2015. So as you can see, he has tremendous experience in the patient advocacy and support space. So welcome, Wee Sing, and also thank you for joining us today. Right. So we will start with Crystal's presentation, and then Wee Sing will talk us through his experience and journey with RDSS. And then we'll have a discussion for about 15 to 20 minutes or so, which should be very enlightening. So without taking too much time, please go ahead, Crystal.
Hi, and thank you so much for having me on this webinar. My name is Crystal Barter. I'm the CEO and founder of a patient advocacy engagement agency called Humanized Health. But more importantly, I'm a patient and a mum of 3 teenagers and a wife. And this presentation is something that I've created for all of you, and it's called the Advocacy Life Cycle. And it's focused on empowering patient voices through strategic engagement and how we can all shape the future of healthcare. So let's go. So why did I title this the Advocacy Life Cycle? Because I feel it represents a journey that is very synonymous with science and healthcare. Because I see advocacy as a life cycle. It's a process that starts very beginning at the core of someone's trauma or lived experience or diagnosis, whether it's for themselves or someone they love about. And then it enables them to grow their experience into something much bigger. And how does the system bend and flex to best support them? And how do we all upskill ourselves to create a better, more welcoming, more inclusive, more diverse advocacy environment, so that it's not always patients pushing against the status quo. It's us all working together to get the very best out of healthcare that we need. And, you know, here's a stat: 60% of patients feel their voices are still not being heard. I am sure in my experience, I've been around for 20 something years, I know that this has improved dramatically, but we still have so far to go. So I'm going to actually show you the little life cycle that I've created, and then we'll go through it step by step. So I'm going to quickly take you through this advocacy life cycle that I've created. And this is literally step by step. that I experienced. You know, the point of diagnosis and discovery is that critical point where everything changes for you as a patient or as a carer. And I think that that's the real beginning. It's the core of where you take your lived experience from here. I could have very much sat back and gone, look, I'm going to go through my experience and then I will step back and not share it, not be an active participant, not be involved in the healthcare environment, and that is fine. But really the next stage that I experienced was self-advocacy, finding my voice, asking more detailed questions, doing a lot more research, being far more active in the decision-making process. I then used that experience and started to advocate for others. Then obviously the advocacy styles and engagement, figuring out where your purpose and passion lies and figuring out how you want to engage in the sector. Then we focus on training and education, a really important pivotal item in this life cycle that is not valued enough. Then we look at the different types of advocates and voices, both in the public and private sense. Then we focus on collaboration and advocacy approaches, so how advocates and patients work with the system. And then we look at engagement and industry and HCPs and what does effective and non-effective advocacy strategies look like. Then we touch on sustainability and resilience, and this is an incredibly powerful moment where I all want us to reflect on the role that patients and advocates play and the pressures that are placed on them. So we explore that a little bit. So I thought I'd start on the diagnosis and discovery phase by sharing a bit about my story. So as I said before, my name is Crystal. I'm a BRCA mutation carrier, which puts me at high risk of breast, ovarian and other cancers. And it's a genetic mutation that is passed from either your mother or your father onto a child. So I've got 3 children. Each of them have a 50-50 chance of carrying this gene mutation. So the work that I do today is obviously in honour of them and in reflection of the future. I want to see a better outcome for them. So I really needed to advocate for myself. I was the first woman in my family to have this knowledge before cancer. So I had to pioneer a new way of accessing care and support and healthcare options. So I was about 25 when I decided to have my breast surgically removed rather than face my risk of cancer. Now, my mum, my nan, my great-grandma, everyone had had cancer. And to me, that was a risk I wasn't willing to take. So it was about, I've been, you know, gosh, about 11 years of different types of preventative surgeries. I've recently just finished my oophorectomy, so removal of ovaries, and I'm on hormone replacement therapy. So I've been through a lot. And very much so, I could have very much turned away and tried to deal with this privately and gone on with my life. But I chose to use my experience to try and help people. And that's why I'm going to take you into the self-advocacy and finding your voice next. But, you know, the diagnosis and the discovery phase is a really, really critical and defining moment in how you access care, the struggles that you face, how you want to use your voice in the sector, if you want to at all. But this moment makes or breaks us as an advocate.
So I think we lost your audio, Crystal.
It could be about driving change. It could be about educating people. It could be about raising funds for research. And studies strongly show that self-advocates often transition into being advocates for others. And I think that's largely because they're motivated. They're motivated through their own lived experience, but they're also wanting to shift the dial for better healthcare for others. So I thought I'd give 3 simple tips to be more effective in your self-advocacy. So I said, ask detailed questions. Don't be afraid to ask healthcare providers to explain everything thoroughly. And I know we don't get a lot of time in the kind of healthcare setting, but it's about being really prepared. So writing those questions down before. It's documenting your journey. So I kept a record. I often keep video records now of my experiences, questions, feelings, everything that I'd faced in different surgeries. And it just enables future content. It enables reflection, and it also allows us to support others with accuracy, like what we really faced at one particular time. Building your network as well. This is the time where you start finding your voice, you start finding yourself, you start reclaiming your power in this space. You start wanting to build your network. And advocacy can be a very, very lonely experience at times. So having a really strong network of people that you can lean into is a really, really important element. So I would like to also give a couple of tips for how healthcare brands can support patient advocacy, especially advocates that want that little bit of extra information. So develop clear and easy to understand resources on conditions, on treatments, on empowering patients to make informed decisions, create spaces for patients to connect, summits, roundtables, offer advocacy training. That is one thing, provide workshops or online courses, and then celebrate patient advocates and validate their experiences and enable them to give hope to others. So I wanted to look at advocacy styles and how advocates can engage in the system. And I think this is good for really healthcare professionals or decision makers to understand the different styles of advocates. So I broke it down into 4, and I've literally been one of these at some point in my life. So I start with the community advocates, and they're generally the ones that like to work in the not-for-profit sector. So with not-for-profits, have more structured roles. Ambassadors, they tend to fundraise for causes, they tend to be volunteers, and that's how you would engage them. They like the comfort of working in that not-for-profit community-based sector. Then you've got the kind of more research and policy advocates. So they tend to be, more focused on creating change, creating noise, engaging healthcare decision makers and government and research institutions. They tend to like to analyse studies and understand how healthcare policies and legislation can be changed. And they tend to have a huge impact. They're very driven. And they can obviously influence change, policies, legislation. They could also have a hand in raising huge government funding for specific initiatives. But they're also at high risk of burnout due to the absolute labour intensiveness of research and policy advocacy. So they're definitely ones that I think need a lot more support to be able to have that longevity in their advocacy. So then we've got public advocates, and obviously that may flow into each one of these different roles, but they tend to use their voices. So you might see them at events or conferences or media outlets, and they tend to use their personal experiences to raise awareness, and they might be keynote speakers, or they might be involved in the media, and they tend to really kind of harness their lived experience that way. And then you've obviously got the social media advocates, and sometimes we might be a bit of all of them, but I tend to say focus on one particular area and do it really well, and then have a touch of each persona in little chunks as well. So they tend to use their lived experience to create a community and content and engagement through digital channels like TikTok and Instagram and sometimes Facebook and Twitter. So they definitely are ones to watch, because as advocacy becomes more digitized, they at the click of a button can sometimes engage millions of people, thousands of people, and some of them have huge followings. So they're definitely a voice for their community. And I always recommend looking at that kind of key influencer engagement roadmap of who you're going to engage when, whether you're a not-for-profit or a healthcare brand, really understanding who the key players are in every single space you want to work in. But, you know, a 2022 survey by Rare Patient Voices found that 74% of patient advocates feel most effective when their advocacy aligns with their strengths. So that's definitely one particular thing that I'm really passionate about, is helping advocates and patients and organizations find their strength and how they fit in the system. So training and education is absolutely essential for effective advocacy. It goes beyond sharing personal experiences, and it helps them become influential voices in healthcare. It helps them not only understand the specifics of their condition, but also how to communicate strategically with a wide range of audiences, from policymakers to healthcare providers and the media. It provides them the skills with balanced storytelling, at times can help them reduce the emotional element of it. It helps them maintain some factual information, adapting their message to resonate with each unique group. And it helps them, most importantly, build confidence and professionalism and the ability to speak clearly and persuasively on complex issues. Ultimately, well-trained advocates can elevate their voices to drive meaningful change and help shape the healthcare system. So this, if you're a healthcare brand, if you have anyone with budget, this training and education piece, you have to have this. If you work with patients, if you work with advocates, if you work with organizations, I want to see every healthcare brand, every government agency invest in this. So collaboration is a powerful way to amplify advocates, and whether you choose to partner with an established organisation or your own initiative or work independently, each approach has its unique strengths. So I like to say, if you don't need to create a not-for-profit, don't. If there is an organisation already working in this space, start a relationship with them. See if you can have a collaboration with them before you go out and start your own organisation. Obviously, starting your own not-for-profit, I've done that. Incredibly labour intensive. It has given me so much joy in my life. But at the end of the day, you have to have the right type of skills, but also the determination and longevity, strength to be able to push through to see that come to fruition. And then obviously there's the independent advocacy, where you kind of drip in and out of collaborating with lots of different stakeholders and bring your own unique take and voice and profile to particular different causes. So engagement by industry and HCPs, we rely, and this is the thing, we rely on a healthcare system that respects us as patient advocates. And we obviously bring hugely valuable lived experience and insights, but there is often an inherent power imbalance when engaging with large structured healthcare entities. And without true support and genuine collaboration, our voices can be marginalised and the critical patient perspectives may go unheard, or it may come off as a bit of a ticker box exercise. When advocates are respected, though, and empowered and included in discussions, it allows for more patient-centred decision-making. And, you know, if we're seen as assets and not challenges to the status quo, this balance of power leads to more transparent, effective policies and a healthcare environment that better serves us all. Because at the end of the day, I know you hear this a lot, but at some point in our lives, we will all be patients. So driving positive change and skills in all of these sectors, HCPs, system, decision makers, industry, to really understand how to be effective in engaging and supporting patients is so critical. So this is a really important slide. So I'm going to really quickly touch on patient engagement done right versus where engagement can go wrong. And for me, being a patient on the receiving end of engagement with healthcare brands or government or agencies, I have experienced the absolute best and the absolute worst. So I think I just wanted to really focus on a few things that I have experienced in my career and also through my agency, Humanised Health, things that we do that really have a positive engagement in patients and organisations and advocates. So a couple of really key points to remember is obviously genuine patient engagement is a two-way street. Patients and advocates deserve respect in this engagement. They need to be considered as experts of their own condition or their own lived experience. And they need to feel confident in providing that feedback. And it's also really important for patients and advocates to provide their insights and feedbacks in a really respectful and controlled manner. So that's where training comes in really importantly. Valuing their time, so paying an honorarium. I always say having a healthcare condition or multiple healthcare conditions is expensive and time is of the greatest value. So if you are a for-profit or a corporate and you have the budget to be able to value organisations, patients and advocates' time, that is the number one thing that can be done right or can be done wrong. A few little things that I have experienced that I've really enjoyed as an advocate is really targeted workshops and training. So everything from skill building to media training to advocacy skill building to understanding policy and storytelling and public speaking. That has really helped me in my career. Ensuring that there's open communication channels, don't just tick a box. And when you engage patients in the work that you're doing, feel that, we're just doing an advisory board or we're just doing this, and then that's the last you'll hear of us. I think relationship building is really important. Implement life cycle engagement throughout the whole life cycle. I know that we are stretched in the healthcare sector, but you can't have as one of your core values of your business, we put patients first, or we engage patients and then not effectively do it. And then obviously diversity in advocates and organisations that you work with. It's really important to hear diverse perspectives. Don't always engage the people that you know are 100% going to agree with you. You want to hear diverse perspectives and you want to gain that true insight through every kind of lens and lived experience. And then obviously where engagement can go wrong is untrained advocates, untrained facilitators, lack of follow through, the missing transparency. You are far better being really upfront about how, why, and where you're going to engage these communities and how they will work with you. And number one, do not do tick a box patient engagement. And honestly, if you've got questions, I'm always happy to answer and give people any advice around these instances. Now, this is one of the last slides for me. And I really wanted to focus and wrap you up and leave you with some thoughts around this that is absolutely one of the most important elements of this whole speech. So I want to leave you with some kind of really critical messages that you can take home and think about how you engage with patients as an organisation or as an advocate yourself or as a healthcare brand. So we need sustainability and resilience in patient advocacy. The reality is advocacy can be incredibly rewarding, but it also has its challenges. For many of us, this work is deeply personal, often tied to trauma and loss or life-changing health experiences. And also engaging those people who carry these histories requires sensitivity, respect, and understanding of the emotional weight that they bring. Sustainability and advocacy means creating space where advocates feel supported, valued, empowered to take breaks when needed. Burnout is real, especially for those of us reliving difficult experiences through our advocacy work. I've seen firsthand how easy it is for advocates to push themselves too hard. feeling like they must keep going because there's always more work to be done. That is not sustainable. The best way to support us is by creating an environment where taking care of ourselves is encouraged and where our time is respected. Also, resilience comes not from pushing through alone, but from knowing we're part of a system that values us as a whole person. This means building engagement models that are flexible, collaborative, and respectful. It means providing training, feedback, and importantly, transparent communication, so we all know our voices are being heard. It also means recognizing that advocates don't have infinite capacity. They need periods of rest and encouragement, a chance to pass the baton on for others. So as advocates, don't forget we have the power to drive change, not just for ourselves, but for entire communities. And for that, we should be valued, we should be trained, we should be supported, and we should be engaged respectfully and ethically, so we can have a more inclusive and responsive healthcare system. Thank you so much for listening to this talk. I hope it helps you in thinking about yourself as an advocate, the system, decision makers, leaders, brands, and obviously reach out to me. You can find me on LinkedIn, Instagram, Crystal Barter, or find me at Humanize Health. Thank you so much.
Thank you, Crystal. That was a very interesting presentation. I do really like the whole life cycle approach to patient advocacy. And by just one look, you can see that there are many opportunities that we can all work together to create better health outcomes. So moving on, probably give the floor to Wee Sing for his presentation. Go ahead, Wee Sing.
Thanks, Yong and Crystal. So I'm here to share about RDSS, and to bring it through, I think I need to perhaps give a little bit background on to what is rare diseases, because that is very close to our heart and that's really what we are advocating for. After that, I'll share about our journey as well as some of the things that we think how we are able to grow through this journey. Right. First up, introduction to rare diseases. So rare diseases is actually being defined in Singapore as a condition that's being is affecting less than 1 in 2,000 patients. Currently, there is an estimate of about 2,000 to 3,000 people living with rare diseases in Singapore, of which 700 are children. Right. Most of the time, majority of it, 70% of rare diseases are actually due to genetic conditions, either hereditary, or it could be, a mutation in the genes. And diagnosis is difficult because it's complex, and very often in many places, including Singapore, we may not have that newborn screening process in place, right? So 75% of our patients actually really have difficulty and take a long time, average about 2 to 3 doctors that they have to see, about 8 reports, and about 7.5 years before a diagnosis is being accurately done. Currently, most of rare diseases don't have any treatments. Only 5% will have some form of treatments. The rest will have to, be cared for, and the condition can be chronic. This is just to give a sense. There are studies out there that shows rare diseases population is about 300 to 400 million people. That's quite huge, yet is a condition that is very much unheard of in the community, in the public, as well as very much underserved. So what are the needs, right, and unique challenges of the rare disease community? First, like I mentioned, the diagnostic odyssey, which Singapore have some programs that we try to expedite or more accurately, diagnose certain new rare diseases like the SingHealth Bridge program. The second is really the lack of access to treatment, right? Lack of access doesn't mean just about the high cost of treatments, which many people have known and associated rare diseases to. But lack of access to treatment also includes, right, the lack of research that's out there. A case in point is, for instance, the 3 years of COVID that we have experienced, right? That actually stop or a lot of rare disease research programs. And after the 3 years, things, are not back to where it left off in terms of rare disease research. So that's one point. The other one is really also about the, the really unstable or rigid production and supply chain, right? Because for rare disease, the demand, I won't say the demand, but the production of such drugs are at very low scale. So it's not on a constant basis that treatment can actually be produced availably. So that will also be a challenge when the real needs are, right? The other one, third point is really the disease burden. We have talked very much on financial burden, treatment costs, medical costs, and other auxiliary costs like consumables, medical consumables, medical equipment, or even specialized wheelchair that many of our patients require. The next is actually the caregiving burden. A lot of our caregivers will experience caregiving burnout because these children are highly dependent and they require a caregiver to be with them 24/7. Then outside of this, there is the parents will also experience a lot of parenting burden with other siblings, as well as, if we are in a sandwich class, having to straddle between caring for the elderly, knowing that Singapore is actually a rapidly aging society, as well as to care for our patients, our children with rare condition, right? Last but not least is the lack of social participation. So our families are very often being cared for at home due to the high medical support need. So there isn't much opportunities for access to many places like spaces, events, or even for education and employment. So that really is a challenge for the family. So that's why a part of the work of RDSS, we do create a lot of events, right, for our patients and families. So coming to RDSS, our mission is really to improve the lives of patients living with rare diseases and their families. And how we do that, we embrace two core values, equity and inclusivity. As you can see, equity means that you give more help to the people who needed it most. Inclusivity means that we try to make our spaces, right, our society accessible and be accessible to all the different groups of the society, including rare disease community, right? So currently we care for more than 200 patients and impacting more than 800 lives. RDSS journey is we are founded in 2011 by a group of 8 families on a shared journey, because rare disease is fairly unknown there then, and the parents feels that they are not emotionally supported, so the parents banded together to provide emotional support to one another. As we grow through the years of advocacy work, and in terms of patient stories that we have shared out there, we are able to gain charity status in 2015, where we are able to then roll out more programs and services. Fast forward to 2022, we have a lot more support from corporates as well as the public, and that's where it pushes us to get our IPC status, which allows us to give tax deduction to donors, and that really drives the tremendous growth in terms of the number of patients coming to us, because of 2 things. I think greater awareness. The other one is we have a better support system now. A very quick overview for us as how we have started. Mainly we have catered to a lot of children at this point, so you can see more than 95% of our beneficiaries are children of 18 years and below. But we are seeing a lot more adults joining RDSS now. And you can see that 60% of these patients are actually being diagnosed between the age of 0 to 3 years old. And the profile of our patients is that they are mostly, more than 80% are highly dependent on a scale of, above 8, 7 to 10. You can see that about 60% are unable to communicate, 30% bedbound, and about 45% relies on some kind of medical device, 63% using a wheelchair, 34% relying on tube feeding. That is really one of the main profile of rare disease groups. But there's something that is not being shown here. Is also a group that looks normal, or what we call invisible disease, right? They look perfectly normal, but they needed medication, they needed treatments in order to thrive. So that also presents another challenge for rare disease community. So for RDSS, we categorize our support systems or programs into 3 key pillars, mainly information support, psychosocial support, and financial support. I shall not dwell in details so that I could have more time to leave time for Q&A later. We do do a lot on patient. We do have a patient flyers that we distribute to hospitals and also to grassroots, in order to reach out to families that are out there who are unknown to us, or who do not know that there's actually some services and some form of systemic support. Next, I'd like to move on to how we see we are able to grow over the years, right? One of the things is that we do have a collaborative efforts approach to our patient advocacy work. First and foremost, we collaborate with many different rare disease patient groups in Singapore. These are just some of the few that are here. There are about 10 of us. But really coming together, we are able to then share resources, as well as to share collective practices and knowledge, and that really helps in terms of creating greater awareness, as well as to creating a better advocacy journey, right? Next, we are very much also be involved in a lot of advocacy with policymakers. We engage the governments in many different platforms and programs. My personal experience is how I got into this advocacy journey with RDSS is I started with the work with the Enabling Master Plan 2030 back then. So we were, the government is actually getting inputs and crafting the 2030 plan, and we got involved in the conversation. Next, really, we are, in Forward SG conversations, as well as working with partners, right? The Rare Disease Funds, MediShield Life, more recently, and ACE, the consumer engagement. Last but not the least, we needed more data. We need to, beyond just patient stories advocacy, we needed to also work on putting up our data to the forefront. That's why we are working with researchers in order to present our needs much better, and to also present some of the research that we are going to embark over the next few years. Last but not the least is very important is the media engagement, right? So through the years, you can see we are able to grow our voices because of the media coverage, because of the engagement, the news papers, our traditional newspapers, as well as more recently, more of a lot of different media production house, even online, some medical related media outlets, and also more recently, we are invited to also the TV, right, and radio, to really share and present. So there's a journey to this growth, and as we start to step up to advocate and share more of our stories, and to share more of our challenges, you'll find that there will be greater awareness, and there will be more engagements to reach the public, and the our reach will be further, right? So besides the news, we also organize advocacy and awareness campaign, either being a part of it or we organize it. So we are always together with the Purple Parade, which is the largest inclusive movement in Singapore. So we participate that annually. The other one is we create campaigns, our own awareness campaigns through, called Carry Hope, in order to gather more people and to raise the awareness and profile of our families, our community, right? So a little side note here is that we have also got a fun fact. We have actually worked with Mandai Group and named, the baby sloth there, Hope, is a namesake for our sloth mascot for Carry Hope. We have also engaged many different ambassadors to help us in terms of the advocacy. Internally, our families, celebrities, as well as our politicians, right? So this a little bit of a public service announcement. We have Carry Hope 2025 upcoming. We hope that everyone could support us to join us at this campaign, to meet the families, to show them that love is not rare. And to give them hope, right, that their challenges and journey ahead should be filled with love and hope, right? Last but not least, we are on this social media, IG, Facebook, and LinkedIn. Happy to connect there to find out more about RDSS work and news. Personally, my email is below as well. Feel free to connect. Yeah. That's all for my presentation. Thank you.
Thank you, Wei Sing. It's really interesting. First, must congratulate your work with IDSS, seeing that the progress you made since 2011, there is really significant progress in improving lives of your beneficiaries and also the society. I also want to do a shout out for you. I was at the Carry Hope Forum early this year, and I had that soft toy, the sloth sorter, and my daughter loves it. So I encourage everyone to participate as well and to contribute. So we have about 15 minutes or so left. Maybe I'll just try to pose some questions to both of you and see whether we can come with some sort of interesting discussion. Again, for everyone else, please feel free to use the Q&A box. We'll try to answer as many as possible. But maybe to start off, I think Crystal gave a really broad and brief overview of what patient advocacy is through your life cycles, the different personas or profiles of patient advocates, which is quite interesting, and I thought maps along on what Wei Sing does with his organization as well. But from both of your experience in real world experience, or what the impact of patient advocacy have you seen on changing healthcare practices, improving outcomes and such? Maybe over to you first, Crystal.
Sure. One really good example that I've been a part of the team that overturned a full ban on genomic life insurance discrimination. I've been working on that for 7 years. Alongside a huge institution in Australia called Monash and a lot of world-leading experts. I always say, like when I broke apart the different personas, the policy and legislation one really is not something that happens overnight. That kind of change takes persistence, really strong evidence and research and data. And, we had to pitch this into consecutive governments, different governments. And it took us 7 years to get a commitment from this current government to overturn genomic life insurance discrimination. And, the US has done it, the UK has done it, Canada has done it, it was Australia's turn. And it was black and white. It was a really simple legislation change. And it took us 7 years to do it. So that's a really good example of the persistency that's needed to overturn some big kind of issues that need to be tackled, and largely that was led by the community. And so you think about people with families and different kinds of lived experiences and trauma, like that's a big burden to carry. But once it gets overturned, it's the best feeling in the world.
Yeah. So I suppose that the issue on sustainability and resiliency is really important to carry that work forward, especially when it takes so long to have real impact. How about your thoughts, Wei Sing?
Yeah, so I see that on two fronts. On the personal front, I think patient advocacy could result in better engagement with the doctors, and we are able to then build up the trust and close working relationship to explore better treatment plans and treatment outcomes, right? So that's one. But at organization level, when the advocacy is then to the community, RDSS is very much involved in the early stage of the rare disease fund that's being formulated. So in 2018, I think we, through our patients' story that's being shared, it was picked up, and that was the uptake of how the conversation was being filed in the parliament, and that took 1 year to actually came about. This RDF was formed. Yeah, then.
Thanks for both the questions and answers. We know that patient advocacy is a really tough job to do, and to get into that space, trying to grow your own work, etc. Is also very hard. But what do you think are the key challenges for patients or public to become patient advocate? And again, what are the challenges they face when they're already an advocate? Maybe over to Wei Sing first, in your context of the Singaporean ecosystem.
I think Singapore in some ways, by and large, is no different from many of the different continents and the countries in the world. For rare disease space, as you can see, that is something that's very unique, a small population in terms of one particular disease type, but collectively we are a large population. With that, many of the current system that's being designed is not meant to cater to groups like this. So that rare disease in some ways is a societal discourse. So in order to advocate for this, I think and be part of this advocacy work, we have to be very clear, about the cause or the part of the cause where you resonate with you, and to be able to advocate it more clearly and intentionally, right? The other one is really strong communication skills, and not to mention, having a very, very strong heart and mind, because you are going to face a lot of challenges, a lot of rejections, but the cause and the population that the community you are serving should drives you to wanting to continue this journey and make that change. Because making that change is not just for the rare disease community. When the society change at large, there's a lot more other underprivileged or underserved community out there that would also benefit from this change.
Before I let Crystal share her thoughts, maybe again on Wee-Sing, on hindsight, what do you think you could have done, or you wish you had done from 2011 onwards, when you started, or when RDSS was started?
I suppose if we have started it more with end in mind, meaning that we wanted to be a patient organization, probably the journey would have been a bit smoother. But we started very organically, like a patient group. So I think it takes some effort, and at this moment, that's where the transformation is happening. And with all transformation, things are going to get uncomfortable, things are going to get messy. So I think that is one of the key challenge. Yeah.
Crystal, your thoughts?
I definitely think, I've spent a lot of time in the advocacy landscape, and I've done lots of global work and worked with incredible organizations all over the world, like even in the rare disease space. So I think we have to have a level of understanding, and this is really directed to everyone who wants to engage with organizations and patients. We have a day job, and that day job might be running an organization or working or caring for someone. And like in 1 week, I might get a request to be involved in 6, 7, 8 different surveys that are happening, or it might be, a slew of other things that are happening, and not necessarily aligned to things that I'm really driven as an advocate for. So I think it's a balance, right? It's a balance of being able to do the things that we're passionate about, and a balance of being able to do our jobs, our day jobs, and care for our families well, and then also be able to churn through all of the different requests that come from the system to us. And make our way through to things that we're passionate about and we want to be involved in. So I think that's why it's really important for everyone that wants to work with advocates and organizations to really do their research around the organizations and the things that they're working on, the alignment, how you're going to value their time. I ran my own not-for-profit, and you do it part for love, because you're never going to retire on an island with that. So I think it's about, like I said, being respected and being valued, and just making sure that we don't bombard our advocates and organizations 24/7.
Thank you. Crystal, in your extensive experience dealing with patient advocacy with multiple stakeholders, what do you think the future holds for patient engagement? And so far, what's the progress you have seen over your work?
Goodness. Yep. So I'll take you back to like 20 plus years ago when I was a baby advocate navigating the space, and pretty much every door was closed in my face. Every brick wall was in place firmly. We were a hassle to have around, and it wasn't a very welcoming space. Fast forward to today, it is a totally different landscape that we find ourselves in. There's so many improvements that we can make. And I like to think, I'd like to see a bit more structure in how, government agencies, government brands, people engage organizations and patients and make it as easy on them as possible and value their time. But largely, if you want to find the right patients and people to engage with, they are there, and often they are waiting for your call. You just have to make sure that you're approaching them in the right way, you value that relationship, and you engage them appropriately. And at the end of the day, if you're a good person, we're all humans, we make mistakes. I think a level of communication that's really clear, and let's just be human and give and care about each other, because at the end of the day, that's why we do what we do in healthcare.
Thank you. That's fantastic. Back to Wee Sing, I mean, earlier in your presentation, you mentioned you work a lot together with government organizations, ACE, etc. But do you also try to look at working with industry partners to see how you can increase access, especially in the Singapore context, to these medication and drugs for rare diseases?
Yes, so we do. So for RDSS, we are very much, like I mentioned, we work in a very collaborative approach. So we do work with very closely with the pharmaceutical industry to really see how can we improve the access to these treatments and drugs in different ways. While we are still working very much to try to make more systemic and sustainable changes, we are also realistic that this will be a journey. It will take a while, and it will be quite messy before things will turn better, because it's really getting the community, getting everybody, all the stakeholders on board, and to really move in the right direction. And communications and conversation is very important part of this, because we need to build trust in the various stakeholders. Yeah.
So a question to both of you actually. We talk a lot about trust, building relationships, working together with multiple stakeholders and different organizations. But in your experience, what if someone else does not want to work with your organization? How do you approach that particular problem? Maybe over to Christophers.
Oh, goodness. And do you want me to do that from the perspective of, say, a pharmaceutical company who's struggling to engage with, say, an organization or a patient?
I think whichever you feel that is most striking, or something that...
I see a lot of questions come through kind of from the industry perspective, so it might be helpful to do it from that lens. I've worked with lots of different industry companies across the world on their patient advocacy engagement strategies. And I've worked in spaces where a lot of the organizations were anti-pharma or anti-industry and didn't want to engage with them. And they're the ones that you have to really tread lightly with, and you have to build rapport with, and you have to build relationships with. And that doesn't happen overnight. You don't just send them a request and say, I want you to turn up to this and be involved in this. Like what you said, it's about building trust, and it's about building relationships, and that takes time. And I know the thing is, in the drug life cycle, you have time. Like when it goes from ideation through to clinical trial, through to market access, that's years. You should be building relationships right up the beginning. When you know whether that drug comes to market or not, engaging with patients and organizations in a meaningful way will only bring great things to your business, great things to your culture and your staff. But when you actually need those organizations and those patients down the track, they know who you are, they care about what you're doing. And that is true patient and advocacy engagement. It's not just knocking on the door when you need something from them.
Wissing, your experience?
Yeah. So I think that you know, like Krista mentioned, trust takes a while. But there's also we need to, you know, patient organizations or patient groups will have to in some ways upskill, right? Because patient organizations, when we talk about advocacy, we talk about patient stories. This is just one part. When we are engaging different stakeholders, we have to understand where they're coming from, and then we have to show what is our plan, so that we can find a platform to collaborate, so that we can move together and to really bring all the stakeholders and move forward together. For rare disease, the challenge is especially in Singapore context, the challenge is really many of the rare disease patients are actually how you say, they are battling, right, a medical condition, and it's very critical. Access to treatment very often means life and death, or if not a better, you know, care outcome. And not having that sometimes is frustrating. So when we, as a patient organization, we have to balance these two demands, right, between the various stakeholders, and that is also in itself needed a lot of work and care around it.
Yeah, I also agree very much on the point of training. I think we're throwing sometimes patients and advocates who are driven by lived experience and passion and purpose and a fight for survival into very corporate worlds or very government-driven worlds. And we're not giving them any training or set of skills or how to hold themselves in those rooms, how to have difficult conversations and reduce the emotion. And we're throwing them into rooms where, you know, there is this disempowering feeling, and there is, you know, you want them to feel like they have that trust built in themselves as much as the other people in the room. And I feel like we don't provide, you know, the training and the support that these organizations, these patients and these advocates need to be really, truly valued and respected partners in the healthcare landscape.
Yeah, those are both incredible insights. So actually about 3 minutes over time. But maybe I will just give one question and you can just both round up with that question. And I think what I would like to ask is for those out there who are interested to become patient advocates, or maybe for other organizations such as industry or, you know, other stakeholders who wish to engage with patients, where do they start? What kind of point of contact would they need to have? Over to you first, maybe Wissing.
Well, I think there are a lot of platforms like this webinar that's important. So to really sign up, to join, to connect. There's a lot of opportunities to go around, find like-minded people, ask questions, so that we know where to start, how to start, and to find like-minded partner to collaborate when we start. So that is a supportive journey. And yeah, I'm sure you know, the panelists like us, we are very, very happy to connect at any time, you know, to help. Yeah.
So I always think wanting to start is a good thing, right? So I think if it's me going into an organization or a brand or a government, I look at the issue that they're trying to address, or the product that they want to engage patients in, or the, you know, the thing that they want to get stakeholder engagement in, and then you build it around that. And you look at the organizations, you do a stakeholder engagement map, you do all those traditional things to really understand who you want to engage and why you want to engage them, and start building those relationships. Some of them might have a sense of urgency because there's you know, a huge access issue with a drug, and you maybe don't have time to be able to do those things, and you can do, you know, desktop audits and get really quick about it. But if you want to start somewhere, just do it. like start somewhere. I think we can overthink things to the detriment of actually talking to each other. And don't be afraid. Like, exactly, you look at Rare Disorders Society, you're there, you're willing to engage, you're turning up to a webinar, you're doing absolutely incredible work. And there's a perfect example of an organization that's there and ready to collaborate. And there's many more like them.
Thank you. Thank you both again, for agreeing to come to this webinar. I think that was an incredible discussion, really good presentations on both your perspectives on patient advocacy, both at the international and the local level. I do really wish all the best to the both of you. And I think on behalf of CORE and STJHI, again, thank you for agreeing to the webinar. And we will definitely try to reach out more for collaborations, more engagement as well. For our audience, the webinar will be uploaded into our website, so do have a look as well. And then feel free to reach out if you have any questions or collaborations, inquiries. Again, thank you and have a good day, everyone. Bye-bye.
Thank you. Bye-bye.